Hello, my name is Rachel Lamb, and I'm going to be applying for the JCRS Speech Program at Thomas Jefferson University. Starting off with the first question, what comes to mind when you hear the term rehabilitation sciences, and what do you think it involves? Well, when I first hear the term rehabilitation sciences, I picture this certain scene in Doctor Strange. It's where he gets into a pivotal car crash and he ends up injuring his arms and specifically his hands. And since he's a neurosurgeon, this is really, really bad for his career. So this is where he starts going into physical therapy and rehabilitation, and really we start to see his healing journey. But if we're thinking about the definition of it, I think rehabilitation sciences involves medical professionals seeking to help their patients recover, and seeing the progress and really regaining the strength to come back and keep pushing forward. Number two, what types of conditions or injuries do you think rehabilitation professionals help people recover from? Well, I think these professionals help people and the patients recover from various of things. It could be like a broken arm, a broken leg, minor major injuries, diseases, or maybe even speech impediments. Um, and this is why this field has a lot of careers that a lot of people like to see and do, and it's why this program really caught my eye because this program offers a lot of different things and fields, and I just really want to see through the lens of medical and the perspective of these professionals. I want to see how they help their patients on their journey and their progress, and how they really get their patients to get back on their feet and really thrive again. Number three, why do you think rehabilitation is important for people recovering from injuries or managing chronic conditions? And I think rehabilitation is especially vital because it essentially casts the bridge between medical treatment and the real life world, as a doctor might be able to fix a bone or heal a leg, but the rehabilitation and physical therapy is really where the patients start to see progress, and they really it really teaches, and rehab is really a place where they learn how to move and really function again. And rehabilitation prepares the body to handle these real life tasks and come back from their hardships and sufferings they have experienced. And ultimately, rehabilitation is about getting back onto your feet and gaining the strength to do everyday easy tasks, because we take stuff for granted. And I do this a lot too. We take stuff for granted, such as eating with your hands, being able to walk on your feet. We take these things for granted, and when we maybe lose it, we really wish back to what we had before. And number four, last question. Would you be interested in pursuing a career in rehabilitation sciences? Why or why not? I think I'm definitely interested in the healthcare field specifically. Maybe even this field too. Just because I really enjoy helping people learn and recover from what they have suffered from. And I just want, long term, I really want to be a staple in these people's lives and make a positive change on society and the world in general. And I just think that there's something so rewarding about these things. And some specific careers I'm looking into right now is I'm really interested in becoming either a medical dosimetrist or a sonographer, and I'm having a difficult time in choosing because I'm not sure if I want to be I want to help people through the screens where they don't know, or if I want to be talking to patients one on one. That's where I'm really struggling, and I think this program will really help me determine that certain thing that I'm having a hard thing pinpointing certainly. And that is it with my questions. Thank you for listening.